This program starts now.
Thank you, Niranjan. A very good evening to all of you who are participating from across the country of India. And hello and welcome to many of you participating from across the world. We are so delighted to present to you the fourth edition of what has become a regular feature every Saturday evening, India time, 7 to 8 p.m. There is a webinar with useful topics, all related to awareness and prevention of cancer, all leading up to the Global Grace Cancer Run on Sunday, 10-10-21, which is 10th October 2021. Every Saturday evening, we're all agog with an eminent panel of medical experts. And we're so glad that we have such a good panel this evening. We're so grateful to them. We welcome them onto the show. And you will see them in just a minute as I introduce them. But the topic for today is most common cancers. How do we treat them? Most common cancers, how do we treat? So be ready to listen and get some life-changing information, and also be ready with your questions, because you have an opportunity to ask these experts some questions. So we have with us Dr. Chandramohan K. He's going to talk specifically on breast and ovarian cancer, and he's from the Department of Surgical Oncology. Welcome, sir. Welcome, doctor.
Thank you. Thank you.
From Regional Cancer Center, Thiruvananthapuram. Thank you so much for being here. We also have Dr. Harish. He's going to speak very specifically on head and neck cancers. He's a surgical oncologist at Apollo Cancer Institute, Hyderabad. Welcome to you, Dr. Harish. Yes, thank you very much. And then, of course, we are expecting Dr. T.S. Rao. I'll introduce you more when he comes, but we also have Dr. Hemant. He is part of the organizing team and the advisory team and the of Grace Cancer Foundation, which organizes this run. He's a fitness enthusiast himself, and he's a robotic surgical oncologist with Yashoda Hospitals. We're so glad to have this very eminent panel with us, and let's just dive straight into the topic. I just want to tell you a few words about our eminent Dr. Chandramohan here. He's, of course, from the Department of Surgical Oncology at Regional Cancer Center, Thiruvananthapuram. He's been there for more than 2 decades, and with 9 international fellowships, a teacher for MCH at RCC Trivandrum, an external examiner for National Board, various universities for DNB, MCH, Surgical Oncology, plenty of research experience, so many awards, it's a long list. We are so honored to have you, Dr. Chandramohan. And I believe you're going to focus and just enlighten us, especially about breast and ovarian cancer. And we're so glad to have you here. We just hand over the stage to you.
Thank you. Thank you, Pramod.
Yes.
Is my screen visible?
Yes, it is visible. Thank you very much. Yes.
First of all, I thank my real friend, Dr. Chinababu, and also Dr. Hemant for inviting me to this meeting. And in fact, I'm really proud that the Grace Foundation, a foundation Chinababu started in the sweet memory of his mother, whom I knew very well, has served Hyderabad, and now it is serving the mother India as well. And I'm today more than extremely happy to join the 3 pillars of oncology, rather 4 pillars of oncology from Hyderabad, Dr. Subramanian Rao, Dr. Hemant, Dr. Harish, and Dr. Chinababu. And I'll be conveying my greetings from Regional Cancer Center Trivandrum, and I'll be talking a bit about breast and ovarian cancer, the prevention and treatment. So this is Grace Foundation. I'm really a great ardent fan of the activities you do there, and I'm very, very happy to associate with the activities of your association. Again, coming to my topic, cancer. We all know that is not in limelight for a while because now COVID is ruling the world. But you should understand the cancer is a steady threat for humanity. The recent publication of ICMR, which published this year, is saying that In India, there is 13.9 lakh cancers are occurring every year. And by 2025, it is going to be increased by 12% to 15.5 lakhs, 7 lakhs. And if you look into the specific cancers we are going to discuss today, and cancers in general, 103.6 is a figure of affected cancer people among 1 lakh people every year. That means 1 out of 9 of us are going to get some cancer in our lifetime. And especially thinking about ladies' cancer, breast cancer, it is the most common cancer among women. And 29.9 out of a lakh is getting the breast cancer every year. And 1 out of 29 ladies are going to have breast cancer in India. And ovarian cancer is slightly less, 6.4 out of a lakh. 1 out of 133 women are going to get ovarian cancer. Again, looking into survival, I think the most heartening or disheartening aspect of cancer is it kills people. So the survival is the most important outcome of cancer therapy. And this is a data which is taken from the SEER database, which is the US database, which pretty much reflects the number of cancers getting treated and curing in US. And this is also the same figure. If you think about the centers like me, Chinna, and Hemant are operating, our survival is also going to be the same. So in breast cancer, it is localized. 99% people are going to get cured. That means a simple breast lump without any spread to anywhere, which can be detected within 6 months to 1 year. If it is detected, 99% people are going to get cured. And if you think about the regional spread, it has gone to regional nodes like axilla, then even then 86% are getting cured. If it has gone to distant places like bone and lung, 28% is going to get cured. And all stages together, the breast cancer has a good survival. 90% is getting cured in America as well as in good centers like Apollo or RCC Trivandrum. And coming to the ovarian cancer, things are not as good as breast cancer. 93% of the localized cancers are getting cured and people are going to live more than 5 years. Region, it has gone to lymph nodes. That means 75% are going to get cured. It has gone to distant places, only 31%, slightly less, more than the breast cancer, 31% are going to get cured. But all stages combined together, the 5-year survival of ovarian cancer is half that of breast cancer, that is 48%. So most important thing is to how to find out a breast cancer. The breast cancer, as especially in early stages, present as a breast lump, and it is usually painless in early stages. So it is very, very important for a lady to find out a breast lump and get it diagnosed and get it treated so that she will fall into the 99% group where complete cure is possible and survival is possible for 5 years. So what are the tests to be done in breast cancer? There are 3 tests: breast examination, needle aspiration cytology, mammogram. These are called triple tests, and any lady undergoing surgery, especially above 40, they have to undergo these 3 tests. If the doctor is giving it, just ask the doctor to do these 3 tests, which is very, very essential for diagnosing a breast cancer before it is treated. So where do you want to get diagnosed breast cancer before getting treatment? I'll come to that later. Coming to the ovarian cancer diagnosis, the ultrasound abdomen is the key test which helps in diagnosing ovarian cancer. And there is a blood test which is called CA-125. This also helps. So we don't do routine ovarian cancer screening or checkups for public because the incidence is less. It is only 6 per 1 lakh. But any lady doing an ultrasound for some other reason and finding out an ovarian mass, they have to be really, really careful to rule out ovarian cancer by doing ultrasound abdomen and CA-125. Why this is important? Because if you fall into that stage 1 group and pick up an early cancer, your survival is going to be 96%. And I'll like to share a story of one of my staff members who one nurse who used to assist us, and she had a gastritis and she did an ultrasound abdomen, and then a complex cyst was diagnosed in ovary, and immediately, since she worked in our hospital, she was taken and undergone surgery by our team, and that cured her ovarian cancer in an early stages. So this luxury should be available to most ladies because this is very important to diagnose at early stage. Coming to treatment of cancers, that is my topic. There is an important quote by Pablo Picasso, the famous painter, and he's saying that he said that in drawing, nothing is better than the first attempt. So, ladies and gentlemen, in treatment of cancer is also, it is very, very important. Your first surgery is going to decide things. Let it be an ovarian cancer or breast cancer, you had undergone a surgery without diagnosing it, then it is very, you are diagnosed it after the surgery without staging, it is going to be very, very difficult for the oncologists who are going to treat you to cure the disease. So it is very, very important to pinpoint the diagnosis of cancer and get the treatment by an experienced oncologist. And also remember that oncologists don't work in isolation. It's called MDT. A team of doctors has to decide. If you think about any of the best hospitals like Apollo Hospital or Regional Cancer Center Hospital or any oncology hospital, it is going to be an MDT which is going to decide on treatment. It is not doctor alone. So they will chart out the entire package of the disease treatment, and that will be executed in sequential manner, and that will result in excellent cure. So if you have the unfortunate incidence of getting a cancer, your unluck of getting a cancer, please go to hospital and insist for an MDT by an oncology team. This is very, very important. So in short, what is used for treatment are three modalities: surgery, chemotherapy, and radiation therapy. And of course, there are certain other modalities like endocrine therapy, which is very, very important in the management of ovarian cancer as well as breast cancer. The surgery is done by a cancer surgeon, and in breast cancer, it involved the removal of the breast, the lump which is cancerous, as well as doing some tests to find out it has spread to axilla, and removing it by either by axial dissection or by single node biopsy. And this completes the surgical treatment. It contributes to more than 90% of the cure. And then you have to supplement it by doing some other modalities like chemotherapy and radiotherapy when and where it is required. Chemotherapy is given by a medical oncologist, and radiation is given by a radiation oncologist. And these three modalities, along with the endocrine therapy, which is going to be given by the medical oncologist, is going to cure you of the breast cancer. So coming to ovarian cancer, things are slightly different. The surgery is going to be a little big, and it should be done by a surgical oncologist or by a gynae oncologist, and they will do a proper surgery. And the very important thing about doing a ovarian cancer surgery is that you have to diagnose ovarian cancer first. And there may be certain situations where the diagnosis is not correct. Then it has to be operated and treated like it an ovarian cancer. And one more advice I like to give you is that doing laparoscopy for an early cancer, it's little risky unless the laparoscopic surgeon is extremely experienced. So if you go to a surgeon and what happens in an early ovarian cancer, once the surgeon ruptures it inside your abdomen, belly, straightly from stage 1, it becomes stage 1C. That necessitates giving chemotherapy also. So if a ovarian cyst, as my staff in our hospital undergone a good surgery, complete excision total, then they need not undergo chemotherapy. So this is very important. And the treatment modalities are same. It is chemotherapy as well as surgery, and radiation has a very limited role in ovarian cancer. With these three modalities, we can achieve a good cure rate. Anyway, I am given only 10 minutes. I am not going to take much time. The most important thing about preventing cancer is promote healthy diet and lifestyle. I think in this view only that Grace Foundation is organizing a run. I think with the simple exercise like being fit, you can reduce the number of cancers to by 30%. So please be fit, please do exercise, and please look into your diet. And watch out for bad genes. And this is something which is, if you have some familial cancers, many numbers of family are getting cancer, then you have to do some genetic counseling and genetic tests so that the risk of your children or siblings getting cancer can be eliminated. And if you are a lady, please try to get your breast examined after 40 years either by mammogram or clinical examination. This is going to pick up the early breast cancer, and you are going to get cured of the disease at early stage. And if you get an ultrasound on the abdomen and it picks up a cyst in the ovary, please get an opinion and further advice by the oncologist if it is that significant. And also remember that once you have the unfortunate victim of cancer, please go to hospital where an MDT decides treatment of cancer. I think I am stopping now. Thank you very much.
Dr. Chandramohan, thank you very much. Well, brief but very insightful. and a lot of practical tips. And thank you for telling personal stories also. We have a few questions. I don't want to wait for the Q&A because I heard that you're quite held up and you might need to leave a little early. So if you don't mind, can I just ask you some of the questions right away? Yes. So this particular question, quite personal questions coming in from our participants, Dr. Chandramohan. This question, I'm reading it out. I am a 32-year-old lady with a mass lesion in right ovary on CT scan. My doctor is suspecting it to be ovarian cancer. Is fertility preservation possible while treating ovarian cancer? Is fertility preservation possible while treating ovarian cancer? That's the very specific question.
Thank you. It's a nice question. It's a very interesting question. Unfortunately, I could not cover it because I have a short topic. And fertility preservation is possible, but it has to be done properly by a surgical oncologist or gynecologist. Please consult a good team, and they have to look into it. They will look into the staging. They will look into the blood markers, and will tell you whether fertility preservation is possible.
Thank you so much. That was very to the point, and you've given a very positive message that it is possible. I'm moving on to the next question. And as I mentioned, we will cover all your questions right now. What is the role of laparoscopic or robotic surgery in treatment of ovarian cancer?
First of all, laparoscopy has to be done by an extremely good surgeon. See, as I mentioned in my talk, if there's a small cyst in early stage and it ruptures, then it is going to be very difficult for the inexperienced laparoscopy surgeon to prevent the rupture. So it has to be removed in toto, then it remains as stage 1A. With the early grades, you need not give chemotherapy, but the moment it ruptures, then you have to be given chemotherapy. And of course, it has a role in for the staging. And if you have an experienced surgeon, there's a procedure called interval cytoreduction. It has a role. And for cytoreduction also, it has to be really done. If you really account the number of surgical expertise who can do a fantastic ovarian cancer surgery robotically or laparoscopically, I can count on my fingers. It's very few in the country. So if they can do anything, but don't rely on laparoscopy in general for ovarian cancer, unless it is for interval cytoreduction or it's for diagnosis.
Thank you so much, Dr. Chandramohan. I really appreciate the honesty and the clarity with which you're giving answers. 3 more questions, and fortunately you're giving such quick and to the point answers, so I can slip in these 3 questions. This next question says, I'm a 28-year-old lady with a 2-centimeter sized tumor in my left breast. So her question is very practical. Is breast conservation possible while removing the tumor?
2 centimeters is very much possible, but you have to look into various aspects also, like the biopsy, then what's the type of cells in it, the molecular typing of it, and then you have to do some sequential treatment by an MDT. So please go to hospital with a proper MDT, and with a 2-centimeter lump, the breast conservation is always usually possible.
Thank you so much. And in your talk also, it was very reassuring to hear that 99% of the cases are curable. It's a very, very good hit rate. What is the role of hormonal therapy in treatment of breast cancer? Hormonal therapy, specific question on that.
Hormonal therapy is one of the most important aspects of treating breast cancer, either as an adjuvant or a metastatic, or as in a metastatic settings. Adjuvant means the treatment which is given after successful treatment of the localized disease in a curative attempt. Other metastatic, if you have disease, then you will give in a palliative setting. So in both settings, this modality has the power of prolonging your life, and it is given for a long time. There are various drugs are available. There is also some manipulation by which you knock off your ovary. If you're a premenopausal, your ovary can be suppressed either by drugs or surgery or by radiation. Then the effect of estrogen goes down, and the breast cancer is checked with certain drugs. So these drugs are called either called aromatase inhibitors or tamoxifen, and these are fantastic drugs, and it has to be consumed for a long time, and to the tune of 5 to 10 years, these tablets has to be consumed, and they have a very good role in breast cancer eradication.
Thank you so much, Doctor. Last question. Sorry, we are firing you with questions, but it's so useful what you're saying. This is the last one which has come for you. It's about, is radiotherapy always needed if a conservative breast surgery is done?
Radiotherapy is almost always needed, because what happens is you are removing only lump. There is risk of recurrence in breast. So there are certain situations in which radiotherapy can be omitted. For example, you are very elderly lady with ERPR positive tumors. Otherwise, radiotherapy is usually given for breast conservation.
Thank you, Dr. Chandramohan. I understand you may have to go off the screen in some time.